tell me what addiction is.
Uncontrollable behavior.
Uncontrollable behavior. I like that. I like the fact that you've got something that's beyond control and it includes a behavior. It's not just something that happens to people. It's not the substances doing it to them. It's a behavior that's being done. A behavior pattern, compulsive substance abuse, relationships, and other behaviors characterized by over-involvement with the relationship or abuse, as well as a tendency to relapse after the completion of withdrawal. Physical, psychological, social, emotional, spiritual disease characterized by continuous loss of control, preoccupation with the substance or the behavior, things like gambling, work, sex, and use despite consequences, and distortions in thinking, particularly denial. Okay? And those are the elements that really make up what we know as addiction today. Although addiction usually, but not always, begins with a conscious decision to use a drug, and this is where the students that we teach in our courses really struggle, because they're saying, how can this be an addiction? This person's choosing to do this, put that substance in their body. They're choosing to do the things that they're addicted to. And what we say is, yeah, it did start with it, but what happens is, in the process, they change biochemically, and they get to a point where they're not able to control the behavior any longer. Some genetically predisposed individuals, however, become addicted almost immediately with very little progression from use to abuse to dependency. Some students will come to campus and they've been very protected by their families. When they get here, they have not been exposed to use. And the very first time they use, they're off and running. They tank that very first semester or within the first year of being here at Texas Tech. Those are students we have to be concerned about because they haven't known what a substance will do to them. And it's been kind of demonized for them in their world, but they didn't know, and they may not have known, the family may not have disclosed that they had a genetic piece that they were stepping into when they get here. Drug use. In 2007, current users, we were looking at drugs, illegal drugs, 19.9 million is about what we were looking at. Tobacco use, 28.6% of the population 12 and over identified as current users of tobacco. Pain relievers used non-medically for first time, 2.5 million. So 2008, Oxycontin, which is a prescribed medication, 5% of high school seniors using it non-medically. Not prescribed for them, but they're using it. Vicodin, almost 10% of seniors in high school using it. Anabolic steroids, about 2.2% of seniors in high school. Growing concern with prescription drug use, over-the-counter drugs, tobacco, dietary supplements, people wanting to look a certain way and taking substances that are changing how they interact and how their body works. And then steroids, and then present substantial health risk. All of these change how that person is and what their body's able to do. How do we see addiction? Over the years, it's been seen also as excessive behavior, bad habit, personal choice, spiritual deficiency, societal problem. So a lot of shame is rained down on the people that use and abuse. Seen in literature as a significant problem, thus the language tends to be extremely negative. And so the people who use don't reach out for help a lot of times because they feel like those of us who are going to be the ones they're reaching out to are going to be shaming in how we respond. Important disclaimer, today we will we'll take the stance that addiction is a disease, and addiction does not equal moral weakness, deficiency, or a lack of willpower, and that alcohol is a drug, and nicotine and tobacco are drugs as well. Some of the characteristics of addiction involves pursuit of short-term gratification at the expense of long-term harm. The addict only looks at how are they feeling right now and how do they feel better right now, and they stop thinking about how it's going to impact them down the line. Usually they're aware of the damaging consequences, but they continue to use anyway. We'll talk about why that is, and we'll also look at the brain, what's going on with the brain that dictates why that is. Biopsychosocial factors, the genetic predisposition for it, also the biology of what happens once you start taking it, the changes that happen that keep you using and don't allow you to feel like you can stop using because your body has got a craving for it. The psychological piece of I don't feel normal if I'm not using this. Also the social piece of who I'm running with, that the people I'm with, this is what we do. The millennials, we do this kind of, we're marijuana users, we're prescription drug users, whatever, however they fall in socially and they see themselves. Prevention and or treatment must address all the complexity of this. So if we're looking at it as a campus and saying, how do we prevent this? we've got to look at, okay, where do they come to us biologically? What's going on with their brain and their body and the need of this? But then also, how are they psychologically making the leap to be able to continue to use, and what is their social environment saying, and how do we change that? Is there a way to change that? You know, do we work with the individual or do we work with the environment, or a little bit of both? Someone starts off in a place of abstinence. In 2005, we did a survey of about over 3,000 students on the Tech campus, and we found out that about 20% of our students fall into the abstinent place. Now, why would that be?
Religion?
Religion?
Already in recovery?
Maybe to believe it'll mess up their academic.
Okay, so they've seen in their own life up till now that the people that they've known that have used, how their life went, and maybe I need to do something different so I don't end up there. One other thing that people would identify is having a close family member, either a parent or a sibling, that has gone through their own addiction, and it's caused that person to make the choice to be abstinent. Once somebody comes to the place of experimentation, what they've looked at is that in their life, they have made a decision that they want to see what it's like. What's it like to smoke marijuana? What's it like to drink that first beer? Now, when they try it, what usually happens is the body adapts. They may puke the first time they take a few sips on a beer. When they smoke that first marijuana, they cough and they tell everybody, you know, I don't know what the big deal with marijuana is. It didn't have any effect on me. Sometimes their body has to adjust to it. And so that's the experimentation phase. Many people will stay with it long enough to become a user. So user falls in between experimentation and abuse. But many people will say, you know, it doesn't do it for me. And they'll go back to either being abstinent or being, you know, if they're of legal age and they can use alcohol or tobacco, they might be a regular user, but they use within a parameter that makes it healthy for them. We want to say that not everyone that picks up a substance, especially alcohol, ends up being an abuser or an addict. All of you that drink in here, I've just confirmed that it's okay to continue to have that glass of wine or that beer. You know, that's not a problem. But where it becomes problematic is what we were talking about. If somebody has the biological, the psychological, or the social component that sets it up that I can't function with this. So what happens a lot of times in the experimentation phase for that person that's going to have a problem down the line is they feel more social, they feel funnier, they relax. It makes them feel for the first time in their life normal. And I only feel like that when I'm using. Ding, 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 ding. That's the sign that somebody's set up for ending up at the bottom end of this continuum. Abuse is when they start to have the problems. They start missing class, they go on academic probation, and they would never tell anybody it has anything to do with their substance use and abuse, or any kind of addictive issues, staying up all night playing video games, not paying attention to really what's going on in any other area of their life. That's it. And so what's happening in that phase is there's starting to be some consequences, but they're not taking action on the consequences. And that becomes dependency. And dependency is when they have a physical, when they walk away from it, they have a physical craving. They can't not be doing it, which leads then to addiction. The difference between dependency and addiction is dependency is a physical adaptation that the body's had, that they have a craving, and when they don't have it, they feel unsettled. Addiction says, I cannot be without it. They can't go a day without it. Or they can't go a day without thinking about it and planning it and making sure it's going to happen sometime within a time that they can feel okay about. And once they're in addiction, unless something happens, the only thing is institutions, jails, and death. Potential addicts. Substance addictions, obviously, you know, the substance side, but then all of these behavioral addictions. Sex, gambling, shopping, internet, self-injury, eating disorders, work. Others, Facebook, right? Social media. The people that can't put it down. And whenever it dings, they're going, you know, pulling it up under their desk and having to look at it. They can't wait till the end of class. I want to give you some DSM, which is the Diagnostics and Statistics Manual from the Psychological Association. Okay, it's a cross-disciplinary text that allows us to see, you know, how is something defined as a problem. So why is it important? It's used for insurance reimbursement, and the two categories that fall under this are abuse and dependence. You see, addiction isn't there. Okay, addiction is our field. Substance abuse, recurrent use resulting in failure to meet major role obligations, work, school, home. Okay, so that's us in the school. You know, we're looking at that. We're saying if they're not showing up to class, if they're not doing okay in class, you know, they may have a substance abuse problem. Recurrent use in situations where it's physically hazardous, get behind the wheel of a car, when they're in a relationship and they're doing things that are, you know, having to function in school. Recurrent substance-related legal problems on campus, off campus, in their relationships with people. Continued use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of their substance use. A last resort before the dependence diagnosis, and excludes caffeine and nicotine. The presence of maladaptive pattern of substance use resulting in distress, clinically significant impairment and involving at least 3 of the following symptoms: tolerance, withdrawal, use of substance longer than intended, unsuccessful attempts to control their consumption, addiction, not a DSM diagnosis, but what we know is when it becomes the #1 priority in their life and it can be fatal, then we know that's an addiction. Intolerance is the need for more and more of the substance to get the same result. And then withdrawal is the other big thing that we need to know about. Is as soon as they stop taking it, their body goes into withdrawal. It needs more, or they're going to go through symptoms that say their body's starting to detox from the symptom. Marked by ambivalence to change. The only way that somebody changes a lot of times once they're past the dependency point is by hitting bottom to make the change. Relapse potential is the rule. So most people, when they get clean or changed into recovery, they're going to relapse. We're going to look at some scenarios. Jim is an easy, fun-loving guy who likes a few drinks with his friends at parties. Is he an addict or not?
No.
No. Okay, with just that bullet, we see that, you know, people can do that as long as he's safe, as long as there's no negative consequences, right? And it doesn't tell us there are. Jim typically drinks to the point of intoxication on Friday and Saturday nights. Still not a problem, depending on what he does with that. As long as he doesn't get behind the wheel of a car, he doesn't have a fight with his friend, and he's able to wake up the next day and study and do what he needs to do, okay? Jim has begun drinking heavily every day, even when he is alone. Problem. Why does that bullet change?
Because he's not a social drinker anymore.
Okay, so then it's not as part of conviviality, it's not part of him connecting and being part of something, it's now something he's doing to handle what anxiety or whatever other things that may be coming up for him. Sally is a college student in her early 20s. She's very social and outgoing as well as attractive. She's on her school's cross-country team. No problem? Okay. She reports feeling plagued by the thought that she is fat. How many young ladies do you think on campus, and guys today, thinking that they're not in the right fit, right, with the images that are out there? Now, does this put them on her on the continuum? Is she on the continuum? So where would you place her?
I place her near addiction.
Near addiction, just with that thought.
Yeah.
Just the psychology of where she's at places her on the continuum. Sally has a healthy appetite, but her friends always comment on how unfair it is that she can eat as much as she does and not gain weight. Still here, what we see or watching is simply the psychological piece. We don't have necessarily the biology. She's not showing that she's fat. And we don't have the social piece yet. After eating large meals, most meals, Sally feels it's necessary to run long distances to work off dinner. Most of this is a psychological piece, her internal world, with a few outside signs. Would this be something that would come to the attention of a teacher? A student advisor? No. What we find is something has to happen. A bump in the road has to cause them to falter, that they then are brought to a resource that they can then seek help. A sophomore at the university likes to have sex often, not involved in serious relationship, but hooks up with different people 2 to 3 times a week. Okay, now when I show this in my class, some of the students laugh, but then I say, okay, I hear some laughter. Is that laughter of uncomfortability or is that laughter of recognition? And most of them say, you know, it's kind of uncomfortability, but it's out of recognition that there are students that we know that this is where they're at. Gets good grades, honor student, has a part-time job. So, you know, on the outside, everything looks okay. But there's all this that's going on behind the scenes that many of us, you know, in this person's world wouldn't know. Has sexually transmitted disease, but still engages in unprotected sex.
Ooh, risky behavior.
Yeah, very risky behavior and putting other people at risk, right? Spends 3 to 4 days looking at porn on the internet. Are we surprised that it would be a female?
No.
No, because in my classes, there's a lot of sexism around this. A lot of people think, oh, that should have been a male. And I say, well, what if it was a male? And then I say, what if this person was your sister or your brother? Sex addiction comes out of, a lot of times, trauma and their own sexual abuse.